What's the little booster stool that people sit on to
A
elevate?
squatty potty?
Squatty potty? Is
Do you
that
have
what?
any investment in that?
I do not.
Good, I hate it.
Okay. All right, well, there we go. Well, tell me why.
Because it's all wrong. It's all wrong. And there's one thing that's correct about the squatty potty.
So, welcome to VNU Health, powered by Arms Medical. I'm Robert Greer. Today, we are talking pelvic floor health, breathing, and the mind-body link with Dr. Nicole Fleischmann, who is a board-certified urologist, urogynecologist, and also author of The Second Mouth, which was published in October of 2024, so about a year ago. And of course, she is a leader in helping women recover control and also have more comfort. So, by the end of this episode, you're going to take 3 things away: why breathing and everyday habits directly shape our pelvic floor function and pain, and 2 simple practical fixes you can use today to reduce leaking and your pelvic discomfort, and of course, when to move from habit change to medical or surgical care. So, Dr. Fleischmann, one question when I was looking at some of your things that you have posted, I'm completely confused. So, do women actually know how to pee correctly?
Are you confused about that, Robert?
I'm so confused. I was like, I was like, I was like, okay, what's going on here? Because you were picking it apart, and I was like, wow,
Yeah,
this is serious stuff.
yeah,
So, what's
yeah, it
going
is
on?
serious. It's
What's
very
happening? And
serious.
why don't they know women know how to pee correctly? I can certainly understand it's probably because they've never been taught. But what is going on that you make such a bold statement?
How long do we have on this podcast, Robert, to discuss these issues? Because this is a
We
multi-layered
can go episode
question.
1, 2, and 3. We've done that before, just on menopause. So it might be,
Okay.
being 1 and 2 and 3. So let's take it from the start.
Okay, so the question was, why do women not pee or not know how to
Not
pee?
know
And
how to
okay,
do it
so
correctly.
the reason has to do everything with child development. Okay, this is a developmental problem. Okay, and it starts with early childhood toilet training. So we have to go way back to really get to the heart of what's going on with women. Okay, when we learn to pee, we learn to hold. That's the first thing we learn how to do. And that's essentially what gets us out of diapers. Learning to clamp, to hold our urine in and not losing it outside the bathroom. That's what we learn. And that's usually around the age of 2 or 3. In this country anyway, that's when we're toilet training our kids. The problem is that the release pathways, the ones that we're talking about, peeing pathways, and this goes for defecating too, they don't develop properly until the child is older.
Like around what age?
The brain development for peeing and pooping is probably closer to the middle school years. So that doesn't mean you can't pee or poop before then. You absolutely can. But you're using a part of your nervous system that I consider to be like the training wheel part of the nervous system. So for women, especially women, and this is true for boys too, but as they get older, because they develop prostates, this doesn't happen to men the same way. For women, we learn to push out our pee at a very young age. It's the first thing that we learn. And it makes a lot of sense at the time because it works. The problem is, it is not the correct part of our nervous system to be using when we're urinating. The squeezing, pushing pathway, which by the way, every woman is doing, and every woman who says that she doesn't, I just want her to observe her own behaviors because it's a huge aha moment when you watch yourself on the toilet and realize that you cannot pee unless you push, hold your breath, change your posture, something. There is some movement you are doing to activate the release pathway, and it's all incorrect. Every single move you make, whether it's a push, a breath hold, a bearing down, a squeeze, there's several different types of voiding dysfunction, I call it, and I have them mapped down. It's all in the book. There's about 4 different patterns, and everybody's got one of them. You could be a squeeze impressor. You could be a pusher. You could be a weight and peer. There's a lot of different dysfunctions out there, but pushing to pee is really the main one, and most women do not know they're doing it.
It's kind of like the five love languages. Okay, which one are you? And then you can decide which one, and then which ones you actually need to improve on.
Who are you? Are you a squeeze and presser? Are you a pee pusher? Are you a breath holder? Whatever it is, you are doing something to release urine, and it's not actually the thing you're supposed to be doing. Because the thing you're actually supposed to be doing is breathing out your pee. You're supposed to coordinate your breath and your flow. And that is a neurological milestone. It's a milestone, meaning that it's very difficult to learn unless somebody sits down and shows you how. We just don't understand how to coordinate. We haven't developed that skill.
Well, I watched you teach someone on Instagram, and I was blown away. I'm like, okay, well that is a lot of nuances and hand holding to get someone to figure out that. Uh-huh.
I am thoroughly exhausted because all I do is toilet train women all day long. I teach them how to pee without pushing. I teach them how to breathe out their pee. I teach them where their diaphragm is. I teach them where their pelvic floor is. I say your pelvic floor is a muscle over your rectum. It's like the jaw of a mouth. It opens when you breathe. All this stuff that women don't know that would absolutely save them from a lot of the suffering we see every single day.
So if someone is taught how to pee correctly, a woman, how does that then align to their pelvic floor, and what benefit can they experience from it?
So, in order to pee correctly, you have to develop pelvic floor awareness. What does that mean? It means that you can move your pelvic floor muscles as if it was your arm or your leg. So you have to have that kind of brain connection to your pelvic floor to move it correctly. And most people have very little brain connection to their pelvic floor. They know how to squeeze, they know how to kegel. Kegel. Everybody knows how to do that. Go to your kegels. Go kegel. That will help you. Kegeling is an infantile mechanism. Okay. When we squeeze, we are making our problems worse. It helps a lot in the beginning. Like if you've had a child and you have stress incontinence, you can squeeze and hold your pee, but your squeezing muscles are not your pee holding muscles. That's the problem. And if you just keep squeezing, you're going to start to suffocate the other side of your body. You're not getting oxygen or blood flow down there. So I spend a lot of time taking women's pelvic floors down. They're all walking around clenching. They're all walking around actively holding in their pee and their poop, butt clenching, vagina clenching all day long. And I'm telling you, after menopause, that's a huge problem. Huge. So we have to get toilet trained earlier in our lives, not when we're 70. We need to learn the mechanisms of our pelvic floor when we're a little bit younger so we don't start getting into these menopausal patterns, that the recurrent UTIs, the urgency, the frequency. All of that is voiding dysfunction. That's all it is. It's all not opening up your bottom on the toilet to pee. Because when you do that, that all goes away.
So if what's the little booster stool that people sit on to
A
elevate?
squatty potty?
Squatty potty? Is
Do you
that
have
what?
any investment in that?
I do not.
Good, I hate it.
Okay. All right, well, there we go. Well, tell me why.
Because it's all wrong. It's all wrong. And there's one thing that's correct about the squatty potty. So for those of your folks who don't know what the squatty potty is, and unfortunately a lot of people know about it, it's a
We'll
high
put it on the
stool.
screen. So while you're talking about it, we're going to show a squatty potty.
Okay, so a squatty potty is a stool that you put your feet on. You could buy it at Costco. They'll give you two for one. Okay. And this stool puts your feet up higher so that you can bend the angle of your hips, which helps you get the stool out better. The problem is that it's only half the mechanism, and toilet posture is not correct when your knees are above your hips. You need to be leaning forward with your feet on the floor, and you need to have your tailbone free. So the problem with the squatty potty is it plants you right on your tailbone, which is the area that needs to move when you're trying to defecate. It needs to literally move backwards. So if you're planted on it, you're not going to move your tailbone backwards. You're just going to push harder until your hemorrhoids come out.
You're locked in. Oh, and then you got to go see the colorectal surgeon. Then you got to have Dr. Coker.
Right, and then you're gonna literally push your anus out. Good for you. Great job. We don't need to push harder. We need to learn the mechanics of our pelvic floor, that it's a mouth that opens. That's why the book's called The Second Mouth. Because when you understand that your pelvic floor is a jaw, like that moves up and down, our job is to learn to drop the jaw down, and none of us know how to do that. We only know how to keep our mouths like this and push out our pee. So I'm trying to get people to open their jaws
So if you had your wish list of when to train people this technique, what would that look like?
as
Like,
early as possible. So look,
so you
you
said
can
like seven, those age seven,
childhood. And
child.
this is childhood toilet training. It should really be in two stages. The first stage is the holding stage, and most kids are able to do that well. But at the end of the holding stage, we need to tell kids they need to sniff out their pee. They need to understand the concept of the sniff, the nose sniff. That's where the force of the stream
The
comes from, the
mustache.
top of your body. Yes. So I do a lot of I do actually I give every patient a nasal inhaler made of some substance, usually some kind of essential oil. We need to understand that our smell pathways are connected to our urinating pathways and our defecating pathways, just like in dogs. We're animals, all of us, and we totally forget that we are. So when you use your sniff to push your urine out and your stool, everything goes better. Everything goes better. It's just like when I say don't push, you can push really hard if your nasal passages are open. You know, you can use the force of your diaphragm to push out your pee and poop. But if you're just bearing down and raising your intra abdominal pressure, before you know it, your bladder's on the floor. And then I have to fix it. And I'm tired. I just really want women to stop pushing their organs out and everybody telling them it's gravity. It's not gravity, it's you. And it's not anybody's fault. It's just unaware behaviors that women are doing. And we don't educate women on these concepts. So they're doing it over and over and over again, not understanding they're creating their own problems.
So how does that? So the pushing and the mechanism, how they're doing it. What other factors? What other risk factors? Is it childhood? Is it smoking? Is it diet? Is it what are the other areas then that you focus on for your patients?
Okay, so this is about pelvic floor tension. Ultimately, every woman who's incontinent has pelvic floor tension of some kind, even if her pelvic floor is weak, even if she's been to 10 doctors who tells her that her pelvic floor is weak. It's really about an inability to take down the tone of the pelvic floor. Why does that happen? It happens from trauma, sometimes the trauma from childbirth, sometimes it's early childhood trauma, sometimes, God forbid, it's sexual abuse. Sometimes it's handed down to you from your mother who's been abused and she's handed you all her DNA or her epigenetics, what have you. You've modeled her. All right. Sometimes it's because you're a dancer and you've been trained to suck your stomach in. Sometimes because you're a big exerciser and you've been sucking your stomach in. Sometimes because you want to look good in a bikini and you're sucking your stomach in, and butt clenching. These are all behaviors that have been conditioned into us as women. No woman has a flat tummy. Sorry, ladies, but we all kind of know that. We're all hiding over each other. No, my tummy's flat. No, her tummy's flat. No, I can tell you, I make everybody take it down. Everybody's got a giant belly. The skinniest people you see walking down the street, they come into my office. Oh man, do I make them take it down. And they all have big bellies. Why? Because that's how we're designed. Because if you don't know how to let your belly out, you don't know how to breathe.
And we can put the link up from I think one of your Instagrams where you kind of walk through that
Yeah. Yeah.
for a woman that is fit and has to relearn, to your
Oh my
point,
God.
that
Yes.
you are not supposed to be all up
Yes.
and then shallow
Everybody is
breath and
pulling in and pulling up. And I'm just trying to tell women you are suppressing your diaphragm, which is the most healing muscle of your body. If you want to suppress your diaphragm and have flat abs, I will see you in my office putting in a sling. I'm just telling you, understand the consequences of what you're doing. If you make the connections, And you say, listen, doc, I know that I'm creating incontinence in my body, but I really like my abs. I say, go have fun, but don't complain to me when you're peeing in your pants. You decide what's important to you. And by the way, Olympic athletes don't suck in their stomach. They all, if you watch some of these swimmers, they have mobile abdominal walls. They're moving in and out. This whole concept of I need to like pull it in. What's that? Oh my God, I just heard this word. For the hourglass, snarf, you snark, I don't remember what it is. It's some like TikTok word. Everybody's trying to get to look like this.
Hey, so we just got word from our producer that the word that we were looking for is snatched. That's the TikTok of I want to get snatched. And what would that then do to the patients that come see you, Dr. Fleischmann?
Snatched, from what I understand, it is something that happens when you have either plastic surgery to like an abdominoplasty, but it's anything you could do. It's like a body sculpting thing. I want to look like a certain way. Usually it's, the what is 36, 24, 36, what it used to be in my day. But this is not a normal posture for women. And that's what I want. Nobody is made that way. And so if you are going to try to adopt that posture, that snatched posture, you are very high risk for pelvic floor conditions like incontinence and prolapse and all of those things. It may not happen to you when you're young, but you don't want to ruin your age by being snatched.
I love it. That is great. If you go to yoga, that's one of the first things they teach you, and that's that whole release and the fact that you are literally Buddha belly out and in,
Yes.
and letting your diaphragm actually work.
Yeah, but I got to tell you, I've had many yoga teachers in my office with pelvic floor dysfunction.
So what were they doing wrong? Because they do it while they're doing yoga, and then they leave and they go back to where they were before.
It's really a brain bottom connection. And for whatever reason, most people are not making it. It's very simple. You want my simple connection? It's
Come on,
very simple.
let's see it.
Your sniff hits your bottom. So when you take a quick sniff, which is just so do this with me, Rob. Just go like this. Take a sniff. Just your nose. Just your nose. Don't move your head. Just your nose. Do you feel it go through you? It's an impulse to the bottom. That's how you pee. That's a breath. You're not supposed to feel breath in your chest at all. And we are all breathing with the upper half of our body, which is abnormal, dysfunctional. Okay? I don't care what anybody tells you. You're not supposed to fill your lungs to your shoulders. You're supposed to fill your lungs below your waist. That's what diaphragm breathing means. And it's a neurological milestone. And it's the only way to take down the tension in your pelvic floor.
So, Dr. Fleischman, you've got this book, published it last year. Very interesting title, The Second
Yeah.
Mouth.
Yeah. Risque, right? What does it mean, the second mouth?
What's going on? Hidden language, pelvic floor.
Yeah.
What are we talking about here?
So the second mouth is really something that should be more intuitive to us than it is. It should be something we just understand about our bodies, but we do not. What I'm trying to explain is that we have two mouths, one on the top and one on the bottom, okay? And you can decide whether the second mouth is the top mouth or the bottom mouth. I don't care. Okay? But just know that there's two and that when one closes, the other can open. They work in tandem, but they don't work together. So, what that means is that if you open your second mouth, which can, by the way, only happen with a breath, okay, you cannot open your second mouth in any other way but with a proper breath. And some of my patients call these vagina breaths because what you're doing is you're incorporating your pelvic floor into your breath. Okay, you're basically having your diaphragm and your pelvic floor coordinate, and that happens with the sniff that we talked about. So the sniff is what coordinates your pelvic floor and your diaphragm together. And at the end of that sniff in, your pelvic floor opens like the jaw of a mouth. Okay, and what that means is your tailbone is literally moving backward. Okay? Because your tailbone is analogous to the chin of your mouth. So if you think of the chin of your mouth as your tailbone and your pubic bone, which is at the front of your body, as more like your nose, like if it was there, the bridge of your nose, the area in between your pubic bone and your tailbone can be widened with a breath. Okay? It's a breath that starts with your sniff, and you don't allow your guarding reflex to snap at it. So the guarding reflex is a snap. It's a reflex on the other side of our body that clamps us closed. And it's really a childhood reflex. It's one that and it's part of our flight and fight response. So when you are scared, you'll notice everything contracts in. Your pelvic floor does that too. Okay? And for what you're trying to do with your breath is to fight that. Fight that closure that's happening in your pelvic floor because you don't want that to happen without your permission. You don't want it to happen automatically anymore. You want to have complete purposeful actions of your bottom. No more reflexes.
And so what is it training? How is this training your pelvic floor? Is this something that is every single breath you should be doing this? Is this
Well, of course, that's ideal. I mean, we should all be diaphragm breathers. We should all be lower half breathers. But unfortunately, to start every breath that you have with a sniff requires your attention and it requires your forebrain. And we have a lot to do, which doesn't, so for you to walk around doing sniff enhanced respirations all day, it's going, and you can listen, by the way, when you get better at this, it does become second nature. So when someone says take a breath, you sniff. You don't just open your mouth and gulp in air. Okay. It's just you're learning how to regulate your nervous system differently. But getting back to your question, because I lost my train of thought.
is this something that you're going to incorporate all the time? So all of a sudden someone's going like, oh my gosh, how often do I have to do this?
So that's the goal. That's the ideal, but nobody is held to that standard unless you're a monk on a hill. But what you need to do is know what is ideal and you try to reach that as much as possible. But I tell women, don't get caught up in the breathing right away. Learn how to pee. Because once you learn how to release urine from your body using your breath, breathing mechanics become much easier for you. That's why I think this was all supposed to be initiated during toilet training. Not when you're 30 years old trying to figure out how to breathe. The mechanics of toileting teach us how to bring air through our body. But we don't get that lesson. So start with the pee.
So how did that not get passed along? Or what happened in our life or our lifetime that none of this information was passed along?
I have a lot of theories. First of all, you have to understand. First, we have to show that this is actually a thing. Any woman who I train can feel this in her body, and really any man too can feel their sniff hit their bottom. Okay, and they can understand the concept of a guarding reflex. So when you sniff, it stimulates your guarding reflex to clamp at it, and what you want to do is inhibit that clamp. So we call that guarding reflex inhibition training. And it's how you release urine and stool from your body. And by the way, it's how you deliver a child too, because that whole mechanism is all the same. The mechanism of opening, it's the same for all of those things. Whatever comes, and if you've ever been in a delivery, as I haven't done OB in a long time, but I remember that during a delivery, anything can come out. Just wear a hazmat suit because a lot of things come out besides the baby. Because once those muscles release, it all releases together, and that's okay. We can't control everything, but we at least have to know what release means. And we can't just push through tight muscles. We're distorting ourselves. And that's when a lot of pelvic floor injuries happen during childbirth. Push the baby out. But if you're not breathing the baby out, you're not opening your bottom. And it's sort of like going to the dentist and asking your dentist to drill your teeth, but the dental assistant has to hold your mouth open because you don't have the ability to hold it out for them. Okay? You don't need your jaw pried open. You need to learn to open your mouth. And it's just that we haven't developed the skills on the other side of our body. It's a developmental problem. But it can be trained. And if you ask me why this happened, I think it was conditioned out of us. I think it's just the modern day life, the sedentary life. This life that we're in creates a lot of bad habits. And some of those habits is just simple posturing problems that we have sitting at a desk all day, not thinking about how you're sitting. Are you sitting on your tailbone? Are you sitting on your butt clench? Don't sit on a butt clench. Unclench your butt when you're sitting on your butt. It's more like a cushion than sitting on a hard rock. And just understanding that we have control over those muscles and we're not using it. We're just not exerting the control that we have. And we're all getting sick because of it.
That's a great point. I see a children's book coming out.
One day, I have so many, you don't know how many things I am working on right now to try to get people to understand these mechanisms. Because I have to tell you, my field does not. My field does not.
I won't
And
disagree with
and
that.
and it's very sad. It's very sad and very disappointing. I'm extremely disappointed
So
in
you
my
talk about
field.
you talk about your field, but it wasn't, how much of this type of training was actually in your field, or how did you yourself get so passionate about this?
The field of female urology is a very early field. I mean, I will say that it hasn't been around for that long. Urogynecology, female urology, whatever you want to call it, it's definitely um, a new field. It's young. It's in its infancy. But I think the neurophysiology of the pelvic floor has been understood for a really long time. A really long time. We have a lot of really smart people and a lot of great research that basically corroborates all the things that I am telling you, but we have not translated it into clinical medicine. Okay, so the basic science is there, the rat research is there, the fMRI is there. You have very smart people writing protocols on this stuff, and it is not getting to the public. That's what I'm upset about, because what the public knows is nothing, and all they know how to do is Kegel, which is absolutely the opposite of what every woman should be told to do. Nobody should be told to Kegel.
And if you talk to a pelvic floor therapist, most would say most women don't even know how to do that, or
I
that
think they
response.
don't know how to do it because they're already in a Kegel.
Okay,
They
there you go.
walk around in a Kegel and wonder why they can't go any tighter. So most women don't understand. They're not weak. They are too tight. They are too clenched. Okay. And all you're doing is pushing through clenched muscles, which will weaken your tissues so they drop out of you. But it's not the muscles that are the problem. It's that you have no control over them. You haven't learned how to release them to evacuate. And they're getting destroyed in the process.
No, it makes a lot of sense, and certainly. So, in your book, do you lay out those guidelines or suggestions? Walk me through some highlights that someone that picks up your book is going to take home.
The first thing you have to do is learn how to sniff. And I know that sounds crazy because you're like, why is the urologist talking about noses? You know something? It's a neurophysiologic gesture that for some reason is very difficult for most people to do, because the women that I see with incontinence and pelvic floor dysfunction do not know how to sniff. They do not know how to pull air in through their nose as a quick gesture, and I have to literally make them do a full relaxation of their abdominal wall and their butt clench to even be able to pull air in through their nose. You see what we're up against? We're up against really dysfunctional people. And it's not their fault. It's a blind spot in their brains. So they just need someone to guide them through these processes, and they can completely turn it around. As long as you're not too old and you still have some cognition, you don't have dementia, once you have severe neurological issues such as, MS or Parkinson, it's very hard to do guarding reflex inhibition training. But for the majority of the population, it should be part of our development. And we're not getting anything on it. Anything, zero, zippo. What's guarding reflex inhibition training? Why do we sniff out our pee? I mean, I would love for the people to come knocking on my door. Nobody's knocking. Why? Because nobody really wants to hear this stuff. And it's very hard to understand, too. I mean, if you ask me how I take the average woman through this, the first thing I tell her to do is sniff. And just use your nose, do not use your chest, and see if you can feel that impulse hit your bottom. If you can't, relax your bottom, stop clenching below. And as soon as you make that pathway, my sniff hits my bottom, you can learn toilet posture. Okay, and toilet posture is very specific and it's the same for everybody. This is great. I don't have to do any variations. It's the same for everybody. It's straight back, lean forward at your hips. You're making a tripod position. Go online and look up what a tripod position is, okay? Basically, you're leaning forward with a straight back with your feet on the floor. All right. And if your feet don't reach the floor, put a little stool under your feet, but don't make them high because you want your thighs parallel to the floor. Right. You want parallel to the floor. And then you do a body check. Unclamp your glutes and let your belly out. You cannot pee if your belly is sucked in. And all these women who are sucking in their stomachs and pushing out their pee and destroying their sphincters, I have to fix them. So I want you to let your belly out, and it should feel like a giant pregnancy in your lap, and then you sniff. And so I tell people to put their fingers under their nose like a mustache and smell your finger, and you immediately feel your pelvic floor open. That's how you pee. It's not so hard to teach this, but nobody's telling us that this is a thing. So we're not doing it. And by the way, I think men need to open their bottoms too. I'm not going to get on the subject of men because this is a women's health podcast, but I think this affects men too. I'm, it affects humans. This is a human problem.
We also, listen, many of the people that watch this, also are men, not as many, but of course, the women that are watching it will go, oh, honey, you got to watch this little section. So
If you're a man and you're constipated, or you're a woman and you're constipated, just understand you have to learn to lift your tail. You cannot have a tail tucked on the toilet, butt clenching, and wondering why the stool isn't coming out. And this is just childhood stuff.
so let's talk then like prehistoric, pre-toilet training. Is there if you could develop a toilet, what would it look like?
The one we have is fine. We have to acclimate to our environment. And with embodied awareness, we can acclimate with a toilet that's hooked up to our ceiling. Okay. Once you understand how your body works, you're not susceptible to the environmental changes. Back in the time, even 200-300 years ago, we were squatting into holes. And that actually released our pelvic floors more easily for us. So the modern day toilet absolutely changed the pattern. But the thing is, we just need to acclimate. We just have to realize what toilet posture is, that we have to lean forward, we have to let our bellies out, and then we can pee and poop in a hole, or you're not supposed to pee and poop standing up. This is one of the things. This is why I have a problem with some of the men's health stuff, because I don't think men should be standing to pee. I think they should be sitting too, and they should be breathing too. But that's just my thing.
It'll also keep the toilet seat clean.
Yeah, as a mother of two sons, I can tell you I made my boys sit and they fought me on it. But honestly, I think it's healthier for the male bladder not to push, not to strain, not to do anything like that either. You really want to open your muscles with your breath too.
It's like good. So I'm doing it correctly then.
Good. Oh, I'm so proud of you, Rob.
Thank you.
Good. You'll save yourself from prostatism. I love it.
All right. So let's talk med tech. All right. I know you're very passionate about it. Of course, we here at Arms Medical, that's what we like to do, is to bring innovative solutions. We're playing the biologics world, and of course, we've got our dilators, and we look at other areas that we think women could have some improvements. What's going on in your world, in the med tech world? Because I know that's something that we can look forward to.
Yeah, so this is very exciting, okay? Because what I'm trying to do, what I'm looking to do is to build a platform, okay? And this platform is going to incorporate a couple of different things. The first thing, and the thing that I'm most passionate about, is teaching women this, educating women on how their pelvic floors work. And I honestly think we need tech to do it. I can't sit there in the office toilet training everybody. And these are neurophysiological problems. These are motor patterns that are outside of our awareness. Okay. So many women are sucking in their stomachs. They don't know they're doing it. They're butt clenching. They don't know they're doing it. It's not until I teach them how to take down their pelvic floor muscles that they even know they were clenching at all. Okay, so we need some tech to sort of give people, this is where the world of sensors and neurotech is really going to be helpful, because we're going to be able to track women Are you releasing the muscle between your butt cheeks to pee and poop? Are you able to get the air down there and do that kind of release? Because if you can't, we're going to be able to see that you can't, and we're going to be able to train you on that. And I also think that AI is going to be very helpful in this area because we can track facial expressions because the sniff is a very specific facial expression. So I can just tell if you're moving, you're crinkling. I can see how your jaw looks. You have a mirror image of your face and your pelvic floor. So I can see just by what you're doing with your face, the position of your pelvic floor. Believe it or not, they work together. They're like they're mirror images of each other. That's why jaw clenchers are often pelvic floor clenchers because those nerve pathways work together in the brain. So that's the first thing is the neurotech. The second thing is getting better equipment for doctors to treat women. We do not have the correct equipment to even cystoscope women. All the scopes we have are made for men. Did you know that?
Yes.
How long is a flexible scope? 40 centimeters? How
Right.
long is the female urethra?
You,
4.
you can be in the other
So
room and use it.
yes, we do not have the right equipment to take care of women. So I'm trying to fix that. So we're coming up with basically disposable equipment that's short, made for women that we can do injections through, like Botox, whatever it is. We don't have the equipment in the office to treat women, so they're not getting care. They're not getting it because you have to take a woman just to the operating room because you don't have equipment in your office that's suitable for the office. Okay. You can't do injections through long flexible scopes, and that's what everybody owns right now. Okay. So you go to the OR so you can rigid scope a woman. It's also a way too long scope. We've not built equipment for women. So the company that we're building is going to make that equipment, and it's also going to be able to target the external sphincter, which is the closure mechanism that protects us from stress incontinence. Because we don't have the right equipment, we're missing the sphincter, which is at the very opening of the body, so that we're able to target with injectables and things like that. So it can be an injection device as well. And this is just the technology. We need to get better technology to take care of women's anatomy because we have not built it. It's not out there at all. Zero. Zero.
It's true.
I've been working in this field for 25 years without equipment, and I'm tired of it. I'm really tired, and nobody's helping me. So I literally have to go out and make my own tech.
To be able to put tools in every doctor's hands that treat females with the right tools,
It will help a lot. It will help access to care.
it will elevate the level of care and you'll be able to then even advance some of that technology because of just giving them the right tools in the first place.
We have to start somewhere. How about the first cystoscope made for women? I don't know, because we don't have one. We have none. It's so upsetting. And when this hits you, every time I talk about this with people, they're like, "Are you kidding?" I'm like, "No, I'm not kidding." I don't know why we're not screaming about this. There's lots of people who take care of women's urology. They don't notice that we're using scopes that are 5 times the size of what we need.
Yes, across the board, it is, they dump everything in the same tray.
Women and men have different. There's not a lot of equipment that should be, most equipment can be gender neutral. We don't need different eye equipment or ear equipment or ENT equipment. We don't need different equipment for the heart. We don't need the different equipment anywhere. There is one part of the body that nobody can dispute is different between men and women, and we are using the same equipment for both. That's what I'm saying.
100%. That's exactly it. And so that's exciting. We're excited to be able to see those offerings and see that equipment available here in the near future. Other things that you're excited about that you'd like to share with our audience?
I'm excited about everything. I'm excited about the future because I think it's a big wake up call. I think once we start realizing some of these problems, I think we're going to see improvement in our health. And I really look. I hope I'm alive to see it. I hope I'm alive to see change. I think it's going to take a lot of work to sort of understand this stuff. But I think once we do, because I'm just uncovering stuff. I'm not creating it. I'm just saying I'm realizing what's going on, and I think we all kind of need to get on board. And once we do, I think it's going to make a huge difference in women's health. We have to teach women pelvic floor control. We have to teach them how to breathe. And once we do that, we're going to see all of these problems that we're calling overactive bladder and all this stuff. It's going to get better on its own. I look forward to that day because we're draining dollars on this, draining them. We don't need 80% of women to be incontinent. We don't. 80% of women are incontinent.
When you walk into Costco, right, and there is a wall of men's style garments.
We are not supposed to be peeing in our pants when we are older. That is not the way it was supposed to go. It is our punishment from being disembodied, okay? We have to get embodied before that time. It's a very simple concept, and we can change it. I want to change it.
So how do we get more champions to talk about these topics because they're still so hush hush. It's so frustrating.
They're out there. I know a lot of people like me that are screaming. There's a lot of wonderful people in my field and PTs, and I see them all the time. And we're talking more about pelvic health and vaginal health and estrogen and all that good stuff. I mean, there's definitely been a change in the women's health movement, and I really applaud everybody that jumps into it. I think the actual field of urology and urogynecology is slower, but they're coming around. I think it's just a lot, people have been trained in the 1990s, the 1980s. So it's like you have to understand that when people are trained, they're learning concepts that are basically something they have to lose. You have to lose certain things that you learned when you were in training. And it's very hard to get these dinosaurs to lose things, but they're making all the rules. All right. But we're starting to filter through, and the women who are really taking control in this field, they have great ideas. And just remember, it's a new field. We're just starting to get our voices out. I was the first woman urologist that came through my program. Okay, I think there was one 10 years before me, and that was the first one. So understand now 50% of urology residents are women. We are making changes, but until we really get to that point, understanding female pelvic health is still a little bit, you know, in the dark ages.
Listen, we have yourself, your podcast, this particular program. We've got great sponsors. We've got Super Patch, which is the vibral tactile technology. We've got Zyve 7, which is all about gut health because having proper gut health is so important. And we've got people like yourself that are not only a clinician but also pushing forward in the med tech world, which is what is critically needed at this time.
It's crazy. By the way, this is never something I meant to do. I promise you, I had no interest in med tech. I never thought I'd be building a medical device, but no one else was doing it. So here I am. It's like you kind of just do it because no one else is.
100%, and it's an unmet need, and it makes sense, and we're excited to be able to hopefully see it here in the near future. So,
I hope so. Thank
Dr.
you.
Fleischman, thank you so much for being on the
Yeah, this
program.
was really fun,
It's been a
Robert.
pleasure. It's been too long.
I know. My first iPad I ever got was from it was Caldera? Was
Yeah.
that it? Okay. Yeah.
Well,
Thank you.
and of course, got to spend some time with you in the operating room, and that was always a pleasure. And I'm happy to reconnect after all this time, and certainly excited to talk about other topics that you're passionate about on this program. And we'd love to have you back.
Okay, at any time, and thank you for all you do in the field of women's health. We really need these kinds of platforms, so I appreciate you.